Hello. Hi. Good evening. Welcome to AccuCheck Wellthy. Hello. Hi. Good evening. Welcome to AccuCheck Wellthy. Hello. Hi. Good evening. Welcome to AccuCheck Wellthy. Hello, Mr. Chakravarti. Good evening. How are you? Hello, Pramodji. I hope you're taking enough care of your health. Let's wait for all of our AccuCheck Wellthy members. And in case of any doubts you have, do drop in the chat box. We are here to help you, guide you, motivate you. Let's wait for our entire AccuCheck Wealthy family to start today's discussion. Meanwhile, quickly in the chat box, if you can help me, what is today's session on? We will be definitely happy and delighted to discuss with you on this session. Yes. Please drop in the chat box. What is the name of today's session? Yes, we have a guest speaker today. Somebody who is here with us, a special guest who is going to talk to us, a doctor who has come for today's webinar session, who is going to guide us, help us, and tell us on what exactly are the signs and symptoms of diabetes management. Meanwhile, we still have a minute more. Let's wait for our entire AccuCheck Wealthy family to discuss about today's topic. Meanwhile, do drop in your questions in the chat box. We are now a family of 1,25,000 users and we are growing day by day. We will keep helping you improve your health, your blood pressure, your diabetes, your symptoms in diabetes, and how to take care of your health with our program. With this, let's talk and introduce to our speaker for today. So we have Dr. Premalata, who is a part of the Wealthy team. She is an expert, a research scientist who is there with us. She helps us with a lot of information which you see in the research, in the articles for all of us. A doctor with so much experience in all the therapy areas, including diabetes, hypertension, cardiovascular health, cholesterol management, and who has seen more than 1,000 users until today as a part of Wealthy and all of her medical career. We are delighted and happy to have you, Dr. Premlata. Over to you for today's discussion. I'm sure you're going to do great justice to today's topic. Please go ahead.
Thank you so much, Rutuja. Let me share the screen. Good evening, everyone. Hope you are doing good. On behalf of Wealthy Care, I extend my heartfelt gratitude to all of you for joining with us today. So as we embark with the journey together, I encourage you to be actively engaged, post your questions at the end of the session. As we all know, today's session is about signs and symptoms in diabetes management. Okay, coming to diabetes, first, what we usually, in the point of patient's perception, they feel like it's like a roller coaster. So it has ups and it has downs. So actually in the roller coaster, few of us usually enjoy, few of us scream. So it's depending on our choice whether to scream with diabetes or enjoy with a proper management. So today's session, maybe we can start the session thinking in this way. Diabetes challenges me, but I could meet each challenge with a courage, knowledge, and a positive attitude. This is what we have to keep in mind the whole part of our life. So before moving to the session, I think it would be better that we should know exactly what is the difference between signs and symptoms. Symptoms is that what patient experiences, that is, we used to say as subjective experiences or feelings reported by the patient. So if a patient feel, I feel like this, I feel like that, so that will be the symptoms. But what are signs? Signs are usually objective. We can measure in terms of any medical condition, usually measured by healthcare providers, maybe doctors or paramedics or allied health professionals. So these are the main symptoms between signs and symptoms. So first, coming to the point, why we should know about the signs and symptoms and in what way it could help us. So first, if we know about the signs and symptoms, usually in any sort of chronic disease which exists for a period of years, what we can do is first early diagnosis is very important to initiate appropriate treatment and management. Exactly. By being aware of these signs and symptoms, individuals can seek medical attention promptly. See, if I have a symptom, so I can know, okay, this resembles diabetes, so I have to seek medical attention promptly. Then usually these symptoms are maybe bothersome and disruptive. So by recognizing the signs and symptoms, we can manage diabetes efficiently. Individuals can maintain a better quality of life, because see, if we have diabetes and if you are in poor control, obviously day-to-day routine activities get spoiled. So it disturbs our routine life schedule. So for maintaining a better quality of life, knowledge about these signs and symptoms will be highly helpful. Then monitoring our health, and usually if you know about signs and symptoms, it will be a potential warning signs to take appropriate action by seeking medical advice. So it will be a wake up call for individuals to evaluate their healthy lifestyle choices. So, in short or concise, these help prevent or delay the progression of the disease and reduce the risk of complications. This is what we are going to do if we know about signs and symptoms. So, what are all the classic symptoms of diabetes mellitus? So first, see, three things are considered as very important prominent symptoms of diabetes. One, it is polyuria. It is nothing but a medical terminology, which is frequency of urination. So why it happens? Excess sugar in the bloodstream is excreted through urine. So there is a frequency of urination, which is called as polyuria. Then polydipsia. See, excessive thirst. We already told you, like, there will be excessive urination. So that will be causing your dehydration. So a dehydration will initiate or trigger the tendency to take water, drinking large amounts of water, feeling frequency of thirst, which is polydipsia, polyphagia. So frequent and intense hunger. So the patient will be hungry always, even after eating. So because see, in routine functioning or physiology, cell needs energy. So how it takes energy? By metabolism of glucose. Glucose enters into the cells and we get energy. So in case of diabetes, all these gets disrupted. So cells don't receive enough glucose for energy, leading to increased hunger. So polydipsia, polyphagia, and polyuria. So excessive thirst, frequency of urination, and increased hunger. So apart from this, unexplained weight loss. So I think this is to be notable. So if it is a weight loss, usually if we are obese, we plan for a good balanced diet. We do physical activity for decreasing our weight or to have a reduction in BMI or whatever it is. But here, without any of these steps, we have weight loss. It is unexplained weight loss, losing weight without trying or making any changes to the diet or physical activity. So why this happens in diabetes is body cannot use glucose for energy, leading to weight loss as it breaks down fat. Okay, so unexplained weight loss is an important symptom. Then fatigue. I told you earlier, like, see, there is a lack of energy, glucose doesn't enter into the cell. So there is a problem in getting energy. So normally, diabetic patients feel severe fatigue, weakness. Okay, they'll be tired all over the time. So having a good control will have control all these things. Similarly, wounds won't heal because high blood sugar levels can impact the body's ability to heal. Then blood vision. Yes, because high blood sugar can cause fluid to be pulled from the lenses of eyes, affecting the focus. Usually, it affects the focus, causing a blood vision in diabetic patients. Similarly, tingling or numbness. So, numbness usually we can't feel any sensation. So, there might be either burning sensation or pricking sensation or numbness in case of diabetic patients because it leads to peripheral neuropathy where high blood sugar damage the sensory nerves, peripheral nerves. So we experience these kinds of symptoms like tingling, burning, or numbness. Similarly, so these are all the routine symptoms where a diabetic patient experience. Apart from this, we have various symptoms like dry mouth, itchy skin, then some sort of infections, then unexplained irritability. So these are all less common symptoms associated with diabetes mellitus. So knowing about the various types of diabetes is essential for accurate diagnosis. So far we have discussed about the signs and symptoms. Now, before that, you should know what exactly are types of diabetes, how we can deal with it, why it occurs, and how we can deal with it. So, the first picture is common healthy diet or a healthy person, a physiology which happens in a healthy person. What happens in type 1 diabetes and type 2 diabetes? So, we have majority two types of diabetes. Apart from that, we have gestational diabetes, which happens during pregnancy. So first, type 1 diabetes, usually it is often diagnosed in childhood or adolescent. Usually how it occurs, it's an autoimmune condition where body's immune system mistakenly attacks. So either it destroys the insulin producing beta cells, either it produces a little insulin or no insulin. So it's an autoimmune disorder. Still now, it's a big question mark why it is happening. Type 1 diabetes. Type 2 diabetes, when the body becomes insulin resistant, like it is secreting insulin, but it is not active to take action on glucose metabolism. So in that case, it is type 2 diabetes. So either it is not responding to the insulin and the pancreas may not produce sufficient insulin. So this is not autoimmune disorder. It happens some damages or to the insulin or beta cells. So even if insulin is secreted, it may become resistant to. So first, either it is type 1 or type 2 diabetes. First thing to be noted is early diagnosis. So early diagnosis will always help in curing or managing a disease. So it is very important because usually diabetes, if it is under poor control, it leads to varieties of complications. What we used to say, diabetes affects top from head to toe, like it involves various systems. So it is crucial. So for avoiding or delaying complications, early detection of diabetes is very helpful. So improving glycemic control and making lifestyle modification may promote better health. So how can be this done? So regulatory health checkup with the healthcare providers, early detection. So all these things will be highly helpful. So managing diabetes can be made easier with the right approach, right knowledge, and support. Support is how we are always ready to give. Like Accucheck Wealthy Care is always ready to help you in all means to overcome all these troubles. Like first, education and awareness will be helpful, which we give through our health coaches, healthy eating, so avoiding processing food or sugary beverages and excessive carbohydrates. So regular physical activity. Similarly, medication adherence. The terminology may look different. Like, see, people always, they are busy with their lifestyle. Obviously, we forget to take medicine. We don't take medicine in proper time. So sticking on to the proper medication schedule is termed as medication adherence. So if we help you people in medication adherence in all means, obviously sugars will be under control. So stress management. So usually stress can affect blood sugar levels. So we should keep ourselves free from the stress in terms of meditation, deep breathing, exercises or yoga, or keeping yourself engaged in your hobbies which you are interested in, and regular health checkups. All these help you to keep you in a healthy way. So as we said, importance of early detection can help avoid many complications. I told you top to toe. Like eyes are getting affected due to diabetic retinopathy, macular edema. These terminologies may look quite odd also, but in common terms, your vision will get affected if you don't have blood sugars under control. Because we said like it affects nerves, peripheral nerves also. Similarly, cardiovascular diseases also getting affected. So once if your diabetes, see obviously it gives in common terminology we can understand if you don't control diabetes, obviously we invite other diseases like coronary artery disease, chronic kidney diseases, sensory motor polyneuropathy, similarly to decays and even cerebrovascular diseases. So to avoid these or to give a halt to this invitation to other diseases, it's better to detect earlier. And if you are detected as diabetes, we can maintain in a good way. Managing diabetes can be easy. Yes, as I told you, healthy eating. So usually we recommend diet taken in the form of low, usually healthy diet should be a balanced one. Since we are diabetic, what we focus is focusing on intake of low glycemic index diet. So I'll let you know what are all the diet which have low glycemic index. So then taking medication properly, which I told you as medication adherence. So being active. So like in case of diet, we used to say count what you eat. Similarly, what you eat, you have to spend those calories in terms of being physically active. Similarly, blood glucose monitoring at regular intervals. Then maintaining emotional well-being in terms of relief from stress, solving problems of higher low blood glucose levels. It means like, so when you feel your blood sugar is low, obviously we know that usually people say like take a chocolate, it will reduce the sugar, it will increase the sugar so that it will give a good result for hypoglycemic condition. But you should not do that. There is a systemic way that these things has to be taken in terms of hypoglycemia, and these steps to be taken in terms of hyperglycemia. Like when your blood sugars are low, we should follow certain condition. When it is high, there is steps to be taken. So lowering the risk of diabetic complications is Simply, you can keep this in mind. Always keep your blood sugar at normal level. Uh, Always we know that diabetes is a challenge. Yes, of course, it is a challenge. But what we can feel is how we are challenging this in a fruitful way. Yes, let's understand about the blood glucose levels. So, okay, in case of hypoglycemia, we all know like blood sugars who are to the level of till 70 to 100, they are considered as a normal person. And if your blood sugar touches 100 to 150, 125 mg per dl, it is considered as pre-diabetic. So when you are in pre-diabetic condition, obviously you are under risk of converted to diabetic at any point of time. If you are not in proper diet, if you are not being physically active at any point of time, you will become diabetic. So pre-diabetic is a riskful condition. Then diabetic, if it is 126 and more than 126 in fasting blood sugars, it is considered as diabetic. Okay, so normal level we all know. So postprandial, usually for those under 50 years, 140 it's fine. If it is 150 for 50 to 60 years, for those more than 60 years, 160 and above. So RBS random, usually what I would suggest is, so these tests all depend on your diet which you are taking on the previous day. But please ensure that you check for HbA1c at regular intervals, not every month, but still I would recommend all my patients like go for HbA1c test at regular intervals to know 3 months averages. That would be highly preferable, and it will give you an idea like you are under poor control or good control, everything. So that we are able to modify our diet, we are able to plan our physical activity or our routine schedules. Hyperglycemia, as we all know, we have discussed that we have type 1 diabetes and type 2 diabetes. Third one, it is gestational, but gestational usually it is reversible, but sometimes it is not reversible, it is irreversible. So taking glucose tolerance test during gestational period is highly preferable. Having diet in terms of keeping gestational diabetes in mind is preferable. So here hyperglycemia, we know very well that it is high blood glucose levels. So high and low blood glucose levels for patient with diabetes is considered as hypoglycemia. If it is 180 mg per dl or higher, it is considered as hyperglycemic. Usually, we have various symptoms in terms of hyperglycemia, but I have seen in my career, in my experience, like people often get confused between hyper and hyperglycemia. Actually, the patient would be under hyperglycemic condition, but the symptoms he feel as hypoglycemia, immediately he eats two or three chocolates. So that is not preferable. When you feel or experience any symptoms of either hyperglycemia or hypoglycemia, I would recommend you to go for a test and then decide whether you are in hyperglycemic or hypoglycemic state, then proceed with the steps to be taken. Because already the patient will be under 300 and 400 plus blood sugar levels. If he is taking 2 to 3 chocolates, that is not the right choice. So the signs of hyperglycemia, hunger will be there, as we told earlier, thirsty will be there, frequent urination like polydipsia, polyphagia, polyuria will be there. These are all signs of hyperglycemia. Then blood vision may exist because we lost the focus because due to severe dehydration, pulling of the fluid. So obviously the focus will be lost, ending up with blood vision. Then severe tiredness. So these are all obviously severe dehydration leads to dryness or coarse of skin. So dry skin, tiredness, blood vision or extra symptoms apart from polydipsia, polyphagia and polyuria. So these are all the symptoms. High blood glucose, when it happens, the body has too little insulin, or the insulin which it is secreted, it is not used properly. In terms like we can say that it is resistant, it is not acting properly. So either secretion will be low or it will not be secreted. Even if it is secreted, it is resistant, which is not helpful for us. Hyperglycemia management and medical intervention. So in terms of medical intervention for diabetes, we used to take oral drugs or insulin. Oral hyperglycemic drugs or insulin. So when you are facing all these symptoms, seek immediate help from your healthcare provider. So when your blood sugar levels stay above 240 mg per dl, you have symptoms of ketones in urine. Obviously, we used to call it as ketoacidosis. So what happens? Even you'll become unconscious. See, these are all not for threatening you people. Like we should know signs and symptoms so that early diagnosis will be done, and we will approach the healthcare provider at regular intervals so that we can treat it very easily. So what we have to do is make an appointment with our healthcare provider. So even when you have to do all these things, you have severe ongoing diarrhea or vomiting, you're not able to take food. See, when you are severely dehydrated and if you're not able to take food, obviously you have to approach your healthcare provider immediately. Similarly, when you have a fever which lasts more than 24 hours, when your blood sugar stays above 240 mg per dl, then you have trouble keeping your blood glucose within your target range. Obviously, I would recommend you to make an appointment with your healthcare provider. Hypoglycemia, as we all know, so when we have low blood sugar levels, so when you have in excess, that is also, it has to be treated or taken care immediately. Similarly, you have to focus for hypoglycemia also. So the condition is more common in people with diabetes who has medications like oral or insulin. That too, if you have insulin, you have to monitor very keenly. So see, if your problem arises in adjusting the dose of insulin. So when you are supposed to give only 10 units, and if you're giving 15 to 20 units, obviously your blood sugar levels will drop down. So diabetic patients who are under medication should be under caution that your blood sugar doesn't go too low also. So it should be maintained within normal limits. Try to follow all the guidelines. So we have two types of hypoglycemia here, reactive hypoglycemia and fasting. So even you, after you eat a meal, at one point of time after digestion or after our regular physiology, after the effect of medicine, you may fall under the category of hypoglycemia after your meal. That is the first thing. Second, during fasting, you may get hypoglycemia. It is more common. During fasting, and if you are taking your drugs, then you will be hypoglycemic too. So that's why medication adherence or knowing the dosage of medicine, knowing the methodology to adjust the dosage of medicine is highly preferable in case of diabetes. So diabetic hypoglycemia, usually we face repeated episodes. Like patient is usually not aware of hypoglycemia. They know only about high sugar levels. They don't know about hypoglycemic condition. In that case, the body and brain no longer produce signs and symptoms. So even I said they will become unconscious too. So in this case, how it occurs is when someone with diabetes doesn't have enough sugar in his or blood below 70 mg per dl, obviously they face too many symptoms, mild to moderate hypoglycemic symptoms. Like first they face tremor. So they are not able to take any, even a pen or a pencil or whatever it is, tremors, feeling so cold, mood changes, lack of energy, severe tiredness, hunger with nausea due to hunger, restlessness, blood vision, and the palpitation, which we called as increase in your heartbeat, fast heartbeat, pale skin, feeling anxious. These are all the mild to moderate hypoglycemic symptom where you should be aware of, and you should be ready to go for a checkup, like test your blood, and if you are hypoglycemic, then we can proceed with the next symptoms, how to deal with it. So when you experience a symptom of hypoglycemia, you should eat chocolate. This is the important question which you should note. Like usually in our day-to-day life with my patients, I used to ask whether you eat chocolates when you are hypoglycemic. They said, yes, I used to have 2 to 3 chocolates in my pocket. If I feel some dizziness, I used to eat chocolate, they used to tell me. But the answer is false. That should not be done. Why? You should not take chocolates in hypoglycemic condition because it's better to take sugar in raw form so that it will get absorbed immediately. Chocolates, it is not a pure form of sugar. It takes enough time to act and improve the blood sugar levels. So what you have to do is take sugar in raw form or glucose D powder, which immediately increases the sugar levels. Should you eat a piece of chocolate immediately? And the answer is no. Should they eat food to make sure his blood levels increase? No, because the food takes its own time for digestion, absorption, then only blood sugar level increases. So in that case, that will not be highly helpful. So instead of having a biscuit or a chocolate, you can carry table sugar, as it is the best method. Okay, in your pocket you can have your table sugar and take it immediately, so it will be highly helpful in increasing your blood sugar levels. So what is there in diabetes management? So managing the diabetes is an art, I used to say. So it's like a roller coaster, which I told you earlier. So we can enjoy the ride. Similarly, people who scream will be screaming. So our patients, what we need is you should start managing the disease in a proper way, in a healthy way, in a good way, in a happier way. So what is there in diabetes management is please go for blood glucose level monitoring at regular intervals. Diabetes medication or insulin therapy should be preferred according to the choice of the healthcare provider. You please do not have your own choice. We healthcare providers are at your side always, so that we would help you in diabetes medication therapy, either oral medication or insulin dosage adjustment. We would try to help you in all means. So you please don't decide the dosage. Similarly, regular physical activity highly helpful, and a proper healthy diet. So healthy diet is a broad terminology. A well balanced diet is a broad terminology. Here we have to apply a well balanced diet, but reduce the intake of carbohydrate, prefer low glycemic index diet, and then prefer accordingly in case. So what is a low glycemic index diet? So a low GI diet means eating food with a low GI score. So what are all the foods which have low GI score is, so less starchy vegetables. For example, cauliflower, broccoli. These all doesn't have starch. So very less and low glycemic index diet. Similarly, what happens if we take low glycemic index diet is like digestion level. The process of digestion also will increase, timing will increase. So what we would say is high fiber diet. Like it used to digest very gradually. It is not absorbed immediately, so that blood sugar will not increase immediately. It will help you in all means. Eating according to low GI diet can help people to better manage their blood sugar and reduce the risk of health complications. So, health complications, I would like to remind you again, it's not like pancreas alone is going to affect it. It is going to affect all the systems like cardiovascular, eyes, cerebrovascular, everything. So it's better to focus on a good diet with a low glycemic index so as to prevent or avoid the complications. So which of the following has high glycemic index? Obviously, mangoes, yes. Starch or carbohydrates is much higher. White bread, it's quite higher. Rice, it's quite higher. So usually we do not prefer intake of all these things. So please focus on your diet in such a way that you should have low glycemic index or low starch. So taking medication on time. Yes, obviously sticking on to medication adherence will help you in all means throughout the life, because taking your medication at the same time every day, keep a reminder, take your medication at the same time. I used to see housewives, usually they are busy with taking care of the family, they don't take medication at proper intervals. So I would recommend everyone to take medication at the same time every day. Incorporate taking your medications into a daily routine like brushing your teeth. Obviously, if we are waking up routinely, we are going for brushing the teeth. Simultaneously, like brushing the teeth, taking medications should be taken considerable at regular time, proper interval. We should create a medicine calendar. So yes, if you're taking the medication, just give a tick mark. So if you are maintaining in your mobile, that is good and fine. So choosing the device or calendar is up to you or up to your perception or your routine usage. Have a calendar or keep notified in your mobile or whatever the devices which you are using. Use a pill container, refill for the whole week. So we will not be missing the dosages. So we will be aware of, yes, I have skipped this dosage. Afternoon medicines I didn't take. I have skipped it unknowingly. So that will be in our control. So you try to use a pill container, refill at same time every week. Purchase timer caps for your pill bottles and schedule them to go off when your next dose is due. So we are purchasing timer caps for pill bottles and scheduling them to go off. Like so, when I bought the medicines, I should know when I have to buy the same, when my next dose is due for purchase. Everything to be taken to consideration. Especially for traveling, it's good enough to take extra doses along with us. So in case of delays, we'll be able to manage. So if we are flying, keep your medications in your hand luggage. So if you are traveling by flights, please keep your medications with your hand luggage. So in case your luggage is lost, so medicines will not be lost. It will be in your hand luggage and it will be easy that you will not skip the dosage of medicines. So medication adherence is an important thing which you have to follow. So diabetes and physical activity. So far, for diabetes and physical activity, so far regarding the diet, we told you like low glycemic index will highly help. How physical activity is going to help us? It improves the responses to insulin. Lowers the, see, we, in diabetes, obviously we know our insulin is not able to act properly against glucose. Here we are making it to improve the response to insulin. Like insulin is responding to glucose and it lowers the blood sugar level. Obviously, it lowers the blood sugar, cholesterol levels and blood pressure. See, controlling the weight is a good part where it will be highly helpful. So I told you like it is obviously inviting in for other comorbidities like cardiovascular diseases. How? So obviously when you are obese or when we are obese, what happens? Obviously, it leads to atherosclerosis or arteriosclerosis. So in that case, if we are controlling the blood sugar levels, it helps in reducing or maintaining the cholesterol levels also and maintaining the weight also. So these are all indirect risk factors for maintaining the diabetes levels. It's not a, please keep this in mind. It is not keeping your diabetes alone in control. It is delaying or halting the progress of complication of diabetes. It reduces the risk of developing diabetic complications. Like we have too many diabetic complications, which we call it as diabetic nephropathy, neuropathy, retinopathy, everything. So obviously we all know in general, if a patient is diabetic for a long period of time, obviously his kidney is getting affected and he is acquiring chronic kidney disease where the kidney is not able to filter the waste and everything. So better the physical activity is highly helpful in maintaining all these things. So managing the stress levels is at our ease. Like we should learn ways to reduce our stress. Either so in what way we like, either it may be a yoga. Few people doesn't prefer yoga. So in that case, you can do what are the activities which you prefer, like gardening, taking a walk, meditating, working on your hobbies. Likewise, listening to the favorite music can reduce your stress level or can raise your stress, usually raise your blood sugar levels, where these modes of steps which we are taking will reduce the stress. So if we need a help to reduce the stress levels, when we are taking all these steps at our own, but it is not productive, what we have to do is ask for help with your healthcare provider, maybe a mental health or psychological counselor, or a support group, a friend, or a family member who will be ready to listen to your concern, which may help you feel better. That would be highly helpful if we relieve our stress levels. So, in general, a diabetic education is important in managing good blood sugar levels. You should be aware of diagnostic facilities, like how we can check blood sugar at home of our own. So every time in terms of emergency in midnight, we are not able to approach hospitals. So in that case, how we will be capable of testing blood sugars at home? So how we will be able to contact our healthcare providers from home? So we have good healthcare professionals who will be always helpful in all means. So individualized treatment, see what we used to say, this is a common terminology. Each and every patient are unique. Like in general, we told you that like these are all diabetic symptoms. Not necessarily all the symptoms will prevail in a single patient. Each and every patient is unique. So individualized treatment, individualized care is mandatory. So better if you are falling under the category of diabetes. So preventing and management of complication should be taken as first priority. How we will do that? Keeping your blood sugar levels at good control. It will halt the progress of your complications. So lifestyle advice. So we will give you advice in terms of diet, in terms of stress level management, in terms of physical activity. So all lifestyle advices will be given. So this will be an organized diabetes care which we are into already. And we are always happy to help you in all these approach. So for personalized dietary plans and diabetic management plans, always reach out to your health coaches. They will help you in all means. Like first see our health coaches, they do analyze your whole history. They used to look into your symptoms. They look into your blood glucose levels. They look into your medications, and they'll give you a specific plan, like see you have to follow all these things, so you'll be under good control, you'll be healthy enough to lead your life very happily. So we are always ready to help you in terms of signs and symptoms, in terms of dietary plans, or whatever difficulties you are facing in terms of diabetes. We always trying to help you. We are happy in helping you all. And thank you for giving the opportunity. Over to Rutuja.
Great. Thank you so much, Dr. Prema. It was really enlightening. Let us first understand if we have any questions from our users so that we can discuss on that. Yes, so few of our users are asking, you recommended having raw sugar in hypoglycemia during midnight. So how much should we take? And if sugar is taken, the fasting blood sugar will increase. So what needs to be done in that situation?
Can I answer, Rutuja?
Yes, please go ahead.
Yeah, thank you so much. Actually, when you're facing a hypoglycemic condition in midnight, at that time, my preference is to save your life in hypoglycemic attack only. So you take half teaspoon of sugar immediately. That would be fine. Don't worry about your fasting sugar, because once if you are hypoglycemic, then your blood sugar will increase. So again, you are going to take either oral drugs or insulin. That will not be an issue. So it's like your emergency management. So where we have to first treat that as a priority. That take your sugar. Don't worry about fasting sugar the very next day. So obviously medication adherence will be there. You'll take your oral drugs that will reduce your blood sugars after intake of this blood sugar. Sugars. That would be highly helpful. So prioritize your situation. That would be main suggestion which I'm giving you. At midnight you are facing a hypoglycemic condition which may take you to coma or unconscious condition. At that time, increasing your blood sugars will be our priority. So we are taking taking sugars will be preferable. Later we can deal with drugs that will be saving your life. Don't worry about the next day fasting sugars. So we are on medication, we will deal with it. No problem. I hope this answers, right?
Thank you for that one, Dr. Prema. There is one more question we would like to help you with. I'm a diabetic. Sometimes I feel indigestion and gastric problem. How to control this? Because it makes me uncomfortable and I cannot work and sleep. If you could help us with this question, Dr. Prema.
Yes, Rajita. Thank you. Actually, look into your diet actually. I think first preference will be your diet modification. Do not eat more spicy food. Dehydration might also serve as a reason for this. Like drink plenty of water too. If you are not CKD patient, like if your kidney is healthy, you can stay hydrated, which will reduce the symptom. But if you are having this problem for a long period of time, better go for a drugs. Contact your healthcare providers. But what I would say is change your diet. Diet will be highly helpful, but not because of indigestion alone your sleep is disturbed. When you check for your blood sugar levels, if your blood sugar levels are not under control, obviously what we saw in last few years experience in diabetes is they are undergoing sleep apnea, like sleep is getting disturbed because of diabetes. So please plan your diet in a proper way. Avoid spicy items. Keep yourself hydrated. In case of long, like chronic symptoms, please take drugs like omeprazole or something like that after getting prescription from your healthcare providers. Please do not self-medicate. That will be my suggestion. Please do not self, because we always mingle disease A with disease B. Considering disease A, we forget disease B also. That's why if you are contacting healthcare provider, they will just look into, examine, and rule out whether this is because of diabetes or something else. Kindly contact your healthcare provider, but first focus on your sugars, sugar levels, and diet. Stay hydrated, please.
Great. Thank you so much, Dr. Prema, for this. There is one more question. In diabetes conditions, the patients usually feel low on energy and they cannot instantly differentiate whether it's hypo or hyper. So, uh, what would be the ideal way to differentiate between these?
Usually, see, if we stayed with the symptoms, even patients can't realize. So that's why we are encouraging them to have a capillary test, strip test at home. Strip test can be done immediately, so to rule out hypoglycemia or hyperglycemia, because if we they explain all symptoms also, practically speaking, in our own families itself, frankly speaking, hypoglycemia and hyperglycemia is not being differentiated. So what you do is do a strip test immediately, confirm whether you are hypoglycemic or not, and go for taking intake of sugar. And if you are hyperglycemic, ensure whether you are taking oral hyperglycemic drugs or insulin corrected dosage. So your doctor would have, or your doctor or diabetic educator would have taught you how a corrected dosage of insulin should be given. So you can proceed with that.
Okay, great. Thank you so much for this one. Let's move to the next one. The user is saying that maybe they don't have all the sufficient things to test the blood sugar, because if they are traveling or they are in the office, it becomes really difficult. So, what needs to be done in that situation?
Better if they are traveling, take blood sugar, sugars itself. Because if it is hyperglycemic, but at home you can take at least half spoon to 1 spoon of sugar. Reduce the quantity of sugar intake while traveling, but take sugars because it will not take you drastically. So take sugars would be preferable if you are not able to test. Hypoglycemia is very dangerous. So we can increase the blood sugar and then we can take drugs. If traveling is the scenario, that would be preferable.
Great. Thank you so much, Dr. Prema. There's one more user who's asking us on what are the easy symptoms? If you can give easy 2, 3 symptoms which can easily be identified that I have diabetes, especially at the beginning stage, at the pre-diabetic stage, and how can users actually go to the doctor? See, because unless and until there is a critical situation, we don't understand that we need to visit the doctor. So in what symptoms does a pre-diabetic need to go to a doctor?
Exactly. That's why I told you three symptoms are mandatory. Like most important symptom, first the patient will feel is frequency of urination, especially at night. If your urination increases at night, think it as your normal routine health checkup and go for sugar test. Frequency of urination, then frequency of thirst and hunger. These three are important symptoms that may feel like you are diabetic. Then, moreover, you are not taking a proper diet. So, sorry, you're not looking into a well balanced diet and you didn't go for any physical activity, but there is an unexplained weight loss. That will also be a main symptom for a pre diabetic, so that you can check for your blood glucose level and you can consider the variations accordingly. So, these four are main symptoms. This will come first, then later or comorbidities or less associated symptoms only. These four are mandatory. That is like we can diagnose diabetes with the help of these symptoms. If the patient has frequency of urination, frequency of thirst, or frequency of hunger, excessive thing, these things happen, obviously they are diabetic.
Thank you so much, Dr. Prema. I think great session today. All of our users must have enjoyed it. And I'm sure that we would have you more as a part of these sessions going forward. Thank you so much for sharing your expert opinion and giving us sufficient knowledge. Thank you. For all our lovely AccuCheck Wealthy users, thank you so much. Next week, we are coming up with a new session, a lot of new information, and a new speaker and a new topic. Meanwhile, take care of your health. We are coming back to you with a lot of new information to manage your diabetes. Thank you. Have a great day. Bye bye.